Everybody. Thanks for joining us today. Lee Verana, sponsorship chair for the Michigan HIMSS chapter. And we have Betsy Freeman, CEO of Radius Advisory Group, and Dr. Trevor Smith, clinical consultant for Verana Health. We're going to kind of do something different, not more of a informative PowerPoint like most of the presentations are. We're going to kind of do more of a video discussion with Dr. Smith and Betsy Freeman. A discussion about telehealth and security, and I'm sure a lot of different things. So we're excited to have them today and really appreciate their time. If you have any questions throughout the presentation, please feel free to type it in the chat box, and we will have a Q&A towards the end of the presentation. I'm just going to do some speaker bios. Betsy Freeman, CEO and founder of Radius Advisory Group. It's a management consultant group focused on cybersecurity and cyberspace issues of national importance. The firm offers strategic advisory services and use case development and testing. She has a long list of accolades. Prior to establishing the new firm, Betsy was the vice president for regional operations at Escolta, an emerging data analytics company based in Virginia. She began development of a cyber portfolio and leveraged data analytics and business intelligence to fuel efforts in a rapidly growing cyber market. Betsy was previously the Department of Defense, or the DoD, Deputy CIO for Business Process and Systems Review, where she initiated the creation of a data analytics function to provide more transparency on IT costs and potential efficiencies across the DoD. She also served in the executive office of the Secretary of Defense, where she was a member of the Defense Efficiencies Task Force under the Secretary of Defense, Robert Gates. Her industry experience includes PricewaterhouseCoopers, where she held concurrent positions as Chief of Staff of America's Utility Industry Practice and Senior Director for Marketing and Business Development. As a U.S. Air Force active duty officer, she also served as media relations strategist and public affairs advisor to the U.S. Air Force Deputy Chief of Staff for Operations and the Air Force General Counsel during the operations Desert Shield and Desert Storm. I know Betsy personally, so thanks so much for joining us today. And then we have Dr. Trevor Smith, clinical consultant and doctor as well with his own practice. He's a Michigan native who grew up in the city of Holland before going to Hope College for his undergraduate degree in chemistry. He's a physician with many interests. While at the University of Michigan Medical School, he developed and co-founded the innovation curriculum and participated in multiple startup accelerators. He then went on to train in ophthalmology at Beaumont Hospital in Royal Oak. In addition to his eye surgery practice, he's a clinical consultant for Verana Health, a leading data health company that has exclusive partnerships with the American Academy of Ophthalmology and the American Academy of Neurology. This consulting position involves a number of roles, including data analysis, data security, software development, telemedicine, and strategy. Most recently, he was involved in the final development of a recent iPhone application, Verana Vision Test, which is also available on the iTunes store. So like I said, we're going to do something different, more of a video discussion. And I just want to thank our speakers today and our annual Michigan HIMSS sponsors, our premier sponsor, Connection, executive sponsors, the MiHCC Group, Blue Cross Blue Shield of Michigan, and Spectrum Enterprise. And then we'll have a Q&A at the end, so if you have any questions, please feel free to put them in the chat box. And we plan on doing, with this pandemic, monthly webinars at least to keep engaged membership throughout the state of Michigan in our HIMSS chapter. So thanks so much for joining us today. That being said, I'm pleased to hand it over to our two outstanding personalities, Betsy and Dr. Smith. Thanks so much for joining us today.
Great, thank you, Lee. We appreciate the opportunity to come and address the group. And my special thanks to Dr. Trevor Smith here, who's made time to come and participate as well. We wanted to, just to kind of tee this up, we wanted to have a discussion about data and security of data, but in an environment that is telehealth, and it's an exploding environment. I don't need to tell anybody on the line that. But there's an interesting intersection between security and privacy and patient care and the business of medicine. And we just recently, as a matter of fact, this morning, did a presentation of the same material to the Michigan Healthcare Cybersecurity Council. And we had some very robust conversation about it because it's an area where there's almost a bigger demand right now for public dialogue about telehealth and what it means to all of us and where it's going, and how the intersection of all those issues of privacy, security, patient care, and the business of medicine come together. And so with that thought that we teed up a couple of handfuls of questions, and we just set this up kind of like a fireside chat. So we'll do that. You're welcome to interrupt us in the middle or wait till the end. We'll make sure we have plenty of time for questions. So having said that, innovative and connective health technologies offer a promise and a solution to many of the challenges that we're facing in healthcare today in the United States, especially during a pandemic like we're having, but even before that. As you know, there's a wide range of care delivery models to help patients manage their conditions through improved self-care and to extend clinical care outside of kind of the traditional settings. Healthcare systems are combining patient-reported information and objective data from telehealth devices and sensors, and they can be used to create patient-centered personalized health interventions, which is really the thing that people are looking for as a patient and is of great interest, of course, to the whole medical stakeholder groups. Although these new technologies promise a lot, there's the quality of care, there's reduced costs in many cases, increased patient satisfaction because of the ease of reaching the doctor and being able to talk to them. They raise a number of issues and a number of questions, which is what our discussion is about today. So with that, one of the ways we started our conversation was to talk about where does security of data, privacy of the individual, and the safety of the patient come to bear. And that was my very first question when I met Dr. Smith, and that's how I knew that he should be on this presentation with me because of his answer. So we'll kind of revisit that question. When you look at patient care, what is the most important thing, and how does it intersect with the issues of privacy and security and the rest?
Sure. Yeah, I mean, this is basically, the patient is the absolute priority across the board. You know, we as physicians, we take an oath to do no harm, and patient safety, patient security. I view security and privacy of patient information to be in the same. It's a subcategory of patient safety. So for me as a physician to be able to provide care, it has to be built on that type of foundation. That's true for walking in the office and knowing the patient has their information secured 24/7, for the patient to be able to come in and know that they're just talking to the doctor and the patient next door can't hear them. And the same thing goes with adopting new technologies. So physicians are going to need to know that they feel safe and comfortable using a technology. And probably one of the core fears is certainly capability. How do I actually use it and log on my Zoom call and all that? But then also just how does it work? And is it going to be the same level of safety for my patient as a regular visit in my office? And worse, the responsibility lands on the organization and the individual physician. And both have to be comfortable and I think working together and know that the company is not at risk and the physician is not at risk, legally and medically, and that takes two. I mean, it takes the whole team.
It does, and of course, the patient just wants that kind of all to be invisible. They just want to get on and have a conversation with their doctor. As a specialist, Dr. Smith, is there a difference between how you look at telemedicine and the practice of telemedicine versus what a generalist might be? Right. And how would you reflect a little bit about how that might be specific to your type of practice? Because it seems that while telemedicine and telehealth are all really great things, that it might not be equal across the board in terms of all things, right?
Yeah, so the way I look at that kind of challenge and breakdown for a bigger healthcare system, they have all different subspecialists. You need to take, I think, the perspective, not just subspecialties. There's individual subspecialty challenges in terms of, can I provide the same level of care as an eye surgeon in my office as telemed? Those are differing from subspecialties, but the actual risks involved with transmitting information, those are technology dependent. So, you know, in the sense that if a cardiologist is using a lot of telemedicine, yeah, they're going to have some more security concerns in their subspecialty. If the eye surgeons aren't using any at all, yeah, they're going to have less risks. So I think it's more which technologies are people using and how often are they using them, rather than each different subspecialty. And I think every subspecialty will have some degree of use with telemedicine.
I think we'll come back around when we open this up for questions, because we actually came up with some questions we wanted to ask the audience as we went forward too. So we'll come back around to that issue. With the continued use of telemedicine and the various technologies that are involved, people have had privacy and security concerns, but some of the recent things that I've read coming out of California Health Foundation, as an example, they did a survey where 66% of the adults that replied to the survey said that while they had privacy concerns, they didn't want that to stop us from learning how technology can improve our healthcare. And they did say that many of them use their own devices to monitor their own healthcare, whether it's a Fitbit type thing or something well beyond that, because there's a lot of different devices out there right now. And they said, the issue here becomes the interest in how do we receive and send data, and how can we protect ourselves, and at the same time actually participate in this as fully as we can. There's a business side of that in terms of risk, and there's a patient side of it in terms of risk, and then there's probably some staff and medical professional risk, and that probably extends to people outside of just doctors and nurses as well. Can you comment on that a little bit?
Just the general, the risk aspect of different layers. I know that I would worry about causing any sort of issue. Certainly, everybody's a stakeholder in privacy and security, because if you violate it, depending on where you work, I mean, there's plenty of organizations that have a zero tolerance policy. I remember that from my resident orientation, that being a big thing that was emphasized. And I think that's important. I mean, you want everybody to be a stakeholder in something that's so important, but you also want it to be the default. You want it to be natural. Patient information is protected in an automated sense. So having good systems in place reduces the risk. Risk will never be zero. We were talking earlier about how EMRs are a solution for so many things. They automate a lot of things, but we still print out from EMRs. So you still have all the inherent risks of paper potentially, and probably less so. You can have all of them depending on how much you're printing. So there's just lots of little teeny tiny holes to, I think, consistently be plugging up manually. And then there's the strength of technology, which is automations that can automatically protect, and they can automatically make mistakes. So, whatever you can do to develop, to pick tools that are the safest, in a way that humans can't mess it up. That's my go-to.
That's hard. So patient care is really inextricably tied to business practices, because at the end of the day, while the patient safety is first, that includes as a subset, as you said at the beginning, their privacy and the security of their data. At the end of the day, cybersecurity is business aligned security. It should be kind of seamless and transparent to the end users as much as possible, both a physician or a nurse, and also to the patient. But there's a balance there, because if you don't have good business practices, you're not going to have a practice, whether you're a hospital or an individual private practice. And that has an impact if there is no service available on patient care. What do you think the biggest, data protection issues might be there? Or how do you see that as a physician in terms of balancing that issue between the excellence of the business itself,
Sure.
right, and the patient care?
Yeah, that is like the challenge of every, I think, health system and individual practitioner, especially in private practice. I think the way I make this is almost like how do you make decisions? The way I make decisions about patient safety and health, or acquiring new technologies and applying them, is to do thorough research. You're trading off either your time or somebody else's time. So if you're looking to get in the telemedicine space and you want to make sure you're not going to violate HIPAA, but you're growing your business, those different types of factors, you either need to know what you're doing or you need to find somebody who does. And there's a lot of great free resources out there. CMS has been helping people along. For me, American Academy of Ophthalmology has been, putting out lots of great information on different billing codes and updates and what you're allowed to do, what you're not allowed to do. And then CMS allowed you to do more, so that's like kind of everybody working hand in hand. And then with COVID-19 on top of all of it, you've got more opportunity, which I think to a lot of, depending on which department you're in, the business or the physician side, those overlap obviously. From the physician perspective, there's just a big question mark on what's the risk. So like huge opportunity, this is great, I want to try it, and I want to take care of my patients, and I can't see them in the office. So, but how do I go about doing that? There's going to be hesitation. So a lot of it is making informed decisions, and then you also have to actually, follow through. You have to choose, not deciding is still a decision. Yes, those are my thoughts on that.
So I think the same is true from the opposite perspective. I'm going to sit in the chair of the patient for a minute. Because while a lot of people see the advantages that telehealth systems are providing and how they can automate tasks, and especially in an emergency like we've had recently, but even before that, to a certain respect, there is a convenience factor and a speed factor, right, versus a risk factor on things. But a lot of this comes down to the trust you have as an individual. And maybe that is just trust in how secure you can be, right? Maybe it's your level of comfort with the technology. But I think a lot of that comes from the doctor, the medical staff, right, that you're dealing with. We were just having a conversation with a colleague over lunch who was saying that he logged in and had a telehealth or telemedicine appointment, and the person at the other end was not familiar with the technology, and they kind of led with that discussion of how they were unfamiliar with the technology and all those things. Well, what was the instant reaction? That made him feel like he shouldn't have even bothered to call, and it made him feel bad, and he didn't really have the outlet he wanted to talk about his medical issue. So with that long preamble, I guess my question really is, how do you see the role of the doctor or medical staff, if you will, in terms of giving comfort to a patient as they start to use the technologies? And what might be some of the things that you would address to a patient as you're starting, to go on the telemedicine journey with them?
I'll give my own preface too, which is that physicians don't use technologies that they don't feel comfortable using. The healthcare industry is very obviously slow to adopt new innovations, and telemedicine is no exception. Certainly there's been a lag due to decreased reimbursement for the last 6 years or so from the new call billing codes that you can use. But you can still develop that, I think, a little bit more.
Good. Without, I guess, going one step further on that question, without trying to stereotype people, have you seen in practice, especially now, I guess, with the big onslaught of telehealth in the COVID-19 era here, have you seen the difference in the kind of the generations, the age generations of people that are more comfortable or less comfortable?
Yeah.
And what can we do to try to mitigate discomfort at this point?
Yeah, and to answer your question about the trust aspect too, I think a physician has a role to reassure the patient, but I do see the, I guess the business, the forward-facing user experience aspect of logging on and seeing a physician. I think the marketing component of just as you're getting on the call with a doctor, that can be automated and taken care of as well. As far as who is going to have some challenges with it, certainly accessibility. I know there's some legislation even being introduced currently to expand high-speed internet. So there's currently, like, you can't really do a quote-unquote real visit where you're able to match the level of billing as in the office as out of the office unless you're doing video. And to do video, you have to have good internet. And the people who are furthest away, they're sort of like, in COVID, we're seeing all the people with telemedicine we were before, maybe like those rural people that don't want to drive, distance assessments. And then there's the factor of you can't even come in and see the doctor because it's not safe. So you've got those two crowds and put them all together at the same time. It's going to, and then there's going to be this third category of people who want to use it because it's really convenient. So right now we've got one big category that kind of pushed it forward from the rural aspect. So the non-stereotype rural groups are still going to need a little boost. I think telemedicine got jumped forward not by the core value proposition of you can see people from a distance. Now it's you can see people from a distance, and you can see people for convenience, and you can see people if it's not safe for them to come in. We've got all three of those going now, and then the safety one will probably go back down, except for small groups like bone marrow transplants and things like that. Maybe they can adapt to some of that. But there's the challenges of internet. There's challenges of how to get on a Zoom call for certain individuals. But I think those are not too bad. I mean, we're fortunate to have great companies like Apple and Google and not to pick any favorites. I mean, there's Zoom calls and Google calls and there's Doxy.me. There's all these companies.
Yeah,
they make it pretty easy, both for patients and for physicians. So it's sort of like we've given everybody a quick try here and there. And I think the comfort level that people have experienced in the last month has been good, you know. So that'll continue to carry it forward.
So that brings me down to a more practical question. When we start looking at all of the upsides and the undersides of telehealth, that whole process has to work into a daily workflow for physicians, nurses, physicians assistants, right? And then actually other people down their supply chain at some point. Talk a little bit about the positives and the challenges you see in terms of workflow where telehealth is concerned.
Yeah, to me, this is one of the most interesting questions of where things are going, trying to predict the future of telemedicine to a certain degree. It's already a thing, you know, people are doing it. But how is it going to be used in the future? You know, to keep up the same volume, you'd have to continue to have physicians be available all the time, not able to see their patients in person, have it be unsafe, and the patients, you know, not having an alternative being in an in-person visit locally. And those are specific to this time period during a pandemic that will not be the case later. And yet, at the same time, if CMS can continue and private health insurance companies, if they can continue to reimburse at a really competitive level to office visits, then you could continue to have a very high trend in the telemedicine direction, which is great. And it's just the question of like, when are those doctors going to see those patients virtually? Where are they going to see those patients virtually? The patients can be wherever, but the doctor's going to be somewhere too. So are they going to be at their home? Are they going to be at a hospital, you know, in a sort of a call center type scenario? And then there's the security, which is why we're here talking about it. There's the security concerns that go along with that. There's any number of hilarious videos online of people, you know, somebody embarrassing walking behind them, or in a medical setting that could be, you know, a lawsuit. Embarrassing, you could potentially lose your job. So, because we're held to a higher standard and you're talking about specific personal health things. So I'm interested to see where it goes. I don't know how much of a prediction I have anyway, but you know, it's going to be a factor of centralized versus decentralized, I think, and it's going to be risk tolerance on the patient's end has to be assessed, risk tolerance for hospitals that are putting this out. And, you know, I think the hospital is going to have to, is of course going to cross their T's and dot their I's and before they can launch it. But meanwhile, you've got big competitors out there that are already moving very fast with telemedicine. So it's going to be interesting.
I think it's especially going to be challenging for a couple of groups that you mentioned, rural and remote people, because they have a consistent challenge whether we're in a COVID environment or not. And if they have been able, with broadband access, if they have it, to be able to use telehealth, it will more than likely, and we'll ask this question to the folks on the phone here in a minute, it will more likely become a go-to because that's what they have access to be able to reach a physician. So that kind of lends itself towards that. One last question, and then we'll open it up for discussion. We've talked a little bit about the environment within COVID and the plus and minuses of telehealth, but when we look at the current environment, we've seen a lot of the rules and legislation around the use of telemedicine as a whole relaxed during this period of time. We've had some discussions previously with compliance officers and attorneys and folks like that to talk about, you know, kind of the impact of that. Where do you see that going? Is this one of those things where, just in your opinion, I'll ask, do you think it's a good thing that those things were relaxed, and should we keep them that way? Because that's what I'm hearing in a lot of different sources now is, hey, don't go back to the restrictive way we were doing things because we've now opened the door and it's offering different types of opportunity. Or do you see a more constricted environment going kind of back into place?
It's such an interesting question because there's every factor is at play, right? And it's the core question of really the internet disrupting. Excuse me. So I think hospital systems are going to have to figure out how they're going to adapt. With being able to get paid for something at a different level that you couldn't get paid for. I mean, some codes are really, you know, almost 8 times as high as they used to be. And it's not like it's buku bucks. It's like, it's equivalent to an office visit. But before, the phone calls that you can make for telemedicine were like, you know, $10 or something. Now you can do like a level 3 for maybe $80 or so. I think it's tough. So we're wondering, should we build this infrastructure? Let's say I'm the hospital system. Do we build it, and are they going to keep paying us for it? So plus it's expensive, and you're building something new after you just lost a lot of money. Yeah. So I think it's inevitable, but it's a question of like, when are people going to be able to afford to build that out within their system? And if they're not able to, you know, you're competing with everybody everywhere now. It's the same thing as the internet. So if you had your own auction site online in like 1998, you know, eBay came along and probably ate your lunch. So the question of, you know, should you build your own eBay, and it's 2005 right now when you just lost a bunch of money? It's going to be interesting to see if healthcare systems will pivot to something that is obviously going to grow and will have probably lower overhead. You know, it's that question of disruption. Will the existing people move towards something that keeps them alive longer? I think.
Very good. Well, with that, we wanted to, Lee, open up to questions and see if we have any comments from the participants. And I would actually love to kick this off by just asking the entire viewing group a question. With all of the advancements in telemedicine happening, we talked to one of the big hospital systems here in Michigan a while ago, and they were saying their plan to roll out telehealth for the next 18 months basically got condensed into 18 days. And so they were kind of making their way in terms of rolling things out. And I was asking, how much of a disruption did that make from a business perspective, from a patient care perspective, and what were kind of the bright spots and the not so bright spots in that journey? I would pose the same question to all of your participants today. We'd be interested in hearing how your experience with telemedicine is going.
Yeah, we don't have anything in the chat yet, unfortunately, so everybody's a little quiet.
No problem. They might have to message you or raise their hand to be able to be unmuted too.
I have a few questions myself. I just find it interesting that I was kind of involved with the providers in the early stages from going from, you know, paper to electronic in the meaningful use program. And after they used it for a while, now they never think they could go back, right? And now we have the data in a structured format. Now we can focus on more important things like interoperability of data for care coordination, quality of care, and gaps in care, data analytics and artificial intelligence. So I find it interesting, you know, I've been trying to convince providers to do telehealth for years as well. So unfortunately, with the recent COVID crisis, it's forced providers to use it, and now they seem to like it. So I don't think it's going away, but like you said, the reimbursement needs to stay there. Hopefully the HIPAA compliancy, you know, is goes on and with some leniency, but we need to make things secure to keep the providers and patients safe. However, how do you ensure that a third-party cloud-based vendor is not only, you know, EMR vendors, but also telehealth vendors are doing their due diligence to secure our data?
Well, I think that gets back to our continuous challenge of, you know, third-party vendor risk. And I kind of have come to believe, aside from the colloquial belief that cybersecurity is collective security, I believe that's more true today than ever. But some of this has to be built into the way we do the business side of this. I know I'm working with a number of clients that have raised that very concernedly, and the answer is it actually goes back to their procurement process. Because until you, as the receiver of their products or services, ensures in their contract that there is some requirement and some teeth to the requirement of ensuring their security to a certain level, even to where you would mandate a level of security, then, you know, they won't be getting contracts from you because you know you're letting the door open to risk. I can't tell you the number of conversations I've had from very large health systems that have said, you know, we've spent all this money to try to keep ourselves more secure, and we realize it's kind of like you're working with the storefront, but at the back door, you have all sorts of things streaming in from third parties, whether it's your HVAC provider or somebody with medical devices, or, you know, the guy that's bringing the printer paper or whatever it happens to be. And until they're secure, you're actually not secure. And of course, that includes people that have clinics that are scattered all over, right? Michigan's a good example of that. We have a lot of big providers that provide services across the entire state for people. And so working collectively is a critical thing, but it does come down to memorandums of agreement. It comes down to, you know, what do you have in your contracts and what are you willing to put in there to sustain them. If you're reading at all about those types of requirements, the Department of Defense is trying to do that very thing right now with their new cyber maturity model. They're struggling very hard to actually have a level of security published so that if you even want to bid on a contract in the DoD of any size, you actually have to meet a certain level of requirements in terms of security, and they have to be validated. And they're trying to make the step from where they used to just say they'd send you the checklist, and of course you had to fill out the checklist and you verified that you were secure. They're not taking that anymore, and they're actually going to send an auditor to you to make sure that you're actually doing what they say you're doing, because the security has a different view to it. So I think until you require it of them in writing, and there's a penalty for non-compliance, mean, that probably seems kind of harsh, but it's probably some serious conversations with your vendors to say, let's all work together, because that makes them more secure for everyone that they deal with, including themselves. And it makes them, more secure in their interaction with you.
Yeah, I just have only a little tiny bit to add, but from just deciding which vendors to use for limited, even just small things, there's a nice little hold harmless clause in a lot of business agreements with different technology providers, and it may not be always possible to essentially cross that out, but I think it's important that whoever's working with you, it's not just a hot potato that they're tossing on your lap and saying, here's the service and you can use it. But, if it ever gets violated, it's not our fault. And I think it needs to be, like you just said, collective ownership. I think if everyone's a stakeholder, everyone cares, and it helps kind of just seal it in and plug the holes in the dam potentially.
So I'm seeing a number of...
Absolutely. I was just going to have one follow-up, and then I'll go to raised hands. Those are good points with the third-party risk management, OCR and the Office of Civil Rights, and they can only do so much, but the HIPAA omnibus rule kind of expanded that to downstream entities as well. So that's beneficial. But I know in our entity, we also request, high trust reports or SOC reports, or at least security risk assessments from third-party vendors too. So I think everybody has to do their own due diligence at their own entities as well.
I think there have been a number of discussions too for some of the larger health systems, and I know I'm seeing this in manufacturing, where there is such a critical need for certain types of services and products in that regard, that the larger systems are actually paying for the smaller systems to have assessments done so that they can actually know where they stand and be able to improve their own security. Because for the larger systems, it's actually much more cost effective to do that than it is to deal with a breach. So I think there's a lot of different ways to approach that, and a lot of those are emerging. I think that's one of the places where HIMSS actually becomes a really important place to have this kind of dialogue, right? Because there is a large enterprise of people from different sources and different blocks. So.
Awesome. Thank you. Sorry for hijacking your first question about the implementation of during this pandemic, but I will open it up to Dan Boyle. I'm going to unmute you.
Oh, thanks, Lee. I got it. So I got a question back to you about how you're handling the data that you need to receive from your patients when you do these telehealth visits. First of all, I deal with a bunch of provider offices and providers that would like to do more in the telehealth space, but up until recently, it wasn't cost effective at all to get set up to deliver telehealth, much less get reimbursed for the visits that you were doing. So, that's why they didn't. Now with, unfortunately, COVID, it's forcing people to do that, and they are recouping some additional dollars. But the problems that they're mentioning are, how can I securely receive data from my patient, put into my EHR? How do we do the different, patient surveys that we ask when patients come in prior to a visit? How do we take down additional data that the patient presents to you during that telehealth visit? Do you have any suggestions, or how do you handle that type of extra data needs? And the other thing is, how do we make sure that it's not recorded on a Zoom meeting and held in a cloud somewhere unprotected? So can you address any of those?
Yeah, I can tell you, like, from a Zoom perspective, well, just big picture, you have to work with a vendor that provides all the aspects of what you just described. All of those are very important factors, both from a legal standpoint, and I think of it from a conscience standpoint as well. I don't want to have those saved somewhere just so I don't have to think about it, to be honest. So there's different policies you could certainly consider, which is just never have any recorded video. I mean, we don't record our visits in the office. I wouldn't imagine you want to record them online either. Same for phone calls or discussions verbally on audio. So there's, each group there's not a universal standard, I guess I would say. It'd be great to develop a standard. I'm sure that's coming, and there's different groups that are working on that. But I would just say you want to make sure, you get all of those factors that you're looking for, and then for each thing that you're adding to the patient's, value in the experience, you just have to make sure there's no significant trade-offs in terms of security, safety, quality of care, and those are all doable. I think those are all solvable problems. Each one of these is a solvable problem, but you don't want to miss one.
So I think from a practical standpoint, I know as I'm working through different things with various clients, especially in the healthcare sector, I will tell you that the business part of the equation, which is the cost of trying to identify what kind of solutions you should have, that cost of actually implementing them and knowing where your cybersecurity stands and being able to monitor what's happening so that it's as secure as you think it is and it should be, right? I've had a lot of conversations about how do you do that collectively with others maybe in your region or your community. I get that everybody's going to be competing for patients to a certain extent online, right, and with their telehealth services. But very often, a collective mind against those solutions doesn't prohibit the ability to compete for patients. But it actually helps secure things from a larger perspective. And I know even, so Lee Verana's on here, we've done a lot of conversations about some of the cost sharing ideas and things that you could actually talk to vendors about. I do a lot of those kinds of discussions with various vendors, and I'm sure Lee and the folks at the consortium up in the UP do that as well as many online. Sometimes you really have to think outside the box here about how could you collectively set your own standard, have a single series of review on some competitive vendors to all sorts of people that, oh, by the way, you might normally compete with, but you're all listening to the same standards because it keeps you all secure. Because in one way or another, especially with specialty doctors and that sort of thing, guess what? Files are going to go from whoever they need to go to the client or to other physicians or, radiologists or pharmacies or whatever. So I think there is a holistic approach that can be taken. And yeah, it kind of flies in the face of tradition in some ways, but I think that the emergence of telehealth, there's more that we don't know than what we do know. And the silver lining to how fast people had a transition under COVID, it actually has people considering things that maybe previously they wouldn't have considered because there's this immediate practical need, right? And so I think that kind of opens the door. The one great thing about the difficulty of economies or health or whatever it might be is that inside the toughest times often come the greatest innovations in that regard. I know that's not probably as specific as you were looking for, but the first thing I would do if I was in your seat is I would be asking other people, what are they using and why? I think you can sort through a lot of that. And like I say, for smaller hospital systems or practices or rural practices, team up with other people. Don't try to go it alone. Open the conversation and see how far you can get to talk with people about it, because you might be surprised people are willing to share information and share costs, and at the same time they can keep their practices very separate and be able to do what they need to do, all while protecting not only their business aspects but their security aspects and their patients, right?
My comment on that is the landscape in this area changes much more rapidly than, how to open a new location in a new city. So to have the most up-to-date or easiest or maybe even most inexpensive, most secure option, it might not be also what everyone else is using. And that's a possibility because it changes very quickly. And you have to figure if you're in a hospital system and you decided to use X company for your telemedicine application, well, it might take you 6 months to get that worked out, start using them. And then you're using them for a while and you get a feel for it and you can maybe recommend it to somebody else. And if you go based off that recommendation and they say it's great, if that's not sort of the company that's going to run for a long period of time, you could end up getting something that doesn't grow, that doesn't build. And, we know of very big EMR companies in the US that don't provide the easiest experience, don't provide necessarily the biggest billing, but they've been around the longest. Yeah. And I think in this world, if it was me and I was running a hospital system, I would not be trying to see how fast can I, pick the first thing that somebody else is using. I would be looking at what is the value of different companies that are doing these telemedicine startups, who are the companies that are maybe only doing telemedicine and how do they do it? And try to approach it from a little bit of a fresh perspective too. Because if you're catching up by using something from 2 years ago, they're probably not going to be the company that offers the most value to you or to your customer potentially.
It occurs to me too, as a final thought on that question, we're leaving out a really important aspect to this, and this is asking your patients. The end user, I think in the end, I know as a patient myself talking to the doctor, I'm okay with telling them, here's the kinds of things I expect you to be able to do when you're talking with me, right? And I think if you ask that even formally or informally, right, you're going to get some parameters about what the user experience is and the level of security that your patients want. And I think that's going to drive the business part of this, because if you don't make your patients happy, they're not going to be there. And so I think that's also a big determining factor, is being able to listen to your patients and ask them, what works best for you, what's easiest for you, and make sure that you meld that as a large part of your answer. I hope that's helpful.
Yeah.
No, that's great. I like the patient engagement piece between the patient portals over the years and now telehealth. We're giving the patients some more options and flexibility, and the providers as well. So it's a good point. Any other questions, please raise your hand or put them in the chat box. I don't see any at this point. Any other discussions, Betsy or Dr. Smith, that you'd like to bring up?
So I think one of the things that, and we're almost at time anyway, but we talked about a number of subjects here, and we tried to kind of cross the waterfront on some of these things, mostly to get people thinking. The continued public dialogue, especially through organizations like HIMSS and others, on a lot of these issues, that nexus between privacy, patient safety, and the balance of business, the underlying thread of keeping data secure, also ensuring its privacy, is something that has to continue, and in a robust fashion. So we greatly appreciate you inviting us to talk about this today. And I know HIMSS does many things online across the nation, and I would just applaud those types of efforts, because I think that as we see the continuance of the emergence of telemedicine, and we look kind of in the rearview mirror at some of the things that we've done during the COVID, but also the future of, will there be more or less legislation? Will there be different kinds of medical consortiums than we've ever seen? Will private practice take on something new? We were talking at the lunch hour with some colleagues about the issue of individual care clinics that are scattered, all over our locations, and how those now are not being utilized as much as they used to be. And could they be utilized for something else in this new age of telemedicine? There's so many possibilities, and it's just really important that the conversations continue in a robust and kind of candid fashion, so that together between the medical community, the insurers, the legislators, private industry, and especially the patients, we can come to a place where telemedicine advances, is secure, and stirs all of us to ensure our own healthcare better.
That's excellent. Go ahead, I'm sorry.
No, I was just going to say, unless there's other questions, I'll kick it back over to you to kind of wrap us up.
Sure. Yeah, I think we're good. We don't have any more, but I would just really like to thank Betsy Freeman and Dr. Trevor Smith. Thanks so much on behalf of the Michigan HIMSS chapter. We really appreciate you joining us today and having this discussion. Two very hot topics in terms of telehealth and security, and so I think it's really relevant for the times. And I just want to give a shout out to our annual sponsors as well. Premier sponsor Connection, executive sponsors the MiHCC Group, Blue Cross Blue Shield of Michigan, and Spectrum Enterprise. Thanks so much and have a great day. Thanks, Betsy and Trevor.
Thanks for inviting us. Bye-bye.
Thank you so much.